Welcome to Healthy Living. Today's topic is diabetes and its impact on the City of Suffolk and its residents. And we're joined now by Dr. Nancy Welch, Acting Director of the Western Tidewater Health District. Dr. Welch, thanks for being with us today.
Pleasure.
Well, let's talk about diabetes. And obviously this is a disease that has an impact nationwide. But in Suffolk, we've seen some numbers on the way up, but more recently we've seen those numbers on the way down, which is a good trend.
Absolutely, absolutely. And there was an article not long ago that sort of called this whole area here, this whole region, sort of the diabetes belt.
Right.
It's not one of those designations one likes to have.
Correct.
And unfortunately, Suffolk was highlighted. And it was based on data that went to about 2008. That was the extent of the data that was available at the time. I'm pleased to say we have some more recent data.
Right.
And so, yes, we are seeing some improved trends. If I may make reference to
Sure.
some graphs that are hopefully appearing on the screen, I want to show one is the diabetes death rate. And you can see on that, if you look at the Suffolk death rate and you look at the Virginia death rate, actually the Suffolk death rate from diabetes, that black line is the trend line, shows a downward trend. And I think that a big change has occurred since 2008. And although I can't prove it, I think that the correlation is probably very strong that this is associated with the availability of the free clinic. And we probably have to give thanks to OBC Foundation and the Suffolk Partnership for that. The reason I say that is because the death rate is a factor of the clinical availability of clinic services to help the individuals that they need medications to have medications, and of the clinical services, a healthcare provider, to do the appropriate test, hemoglobin A1C, for example, to know to guide the patient and to provide the education. So the death rate certainly is very closely correlated with the availability of clinical services. So that's a good side. However, the flip side, if you see this other slide that we have up there, that shows the estimates of the percentage of diabetes, and I do have to say that it's estimated that 1/4 to 1/2 of people who have diabetes don't even know they have it. It's not diagnosed. So that's not even reflected in this chart. And you will see, in contrast to that other nice chart we showed with the downward trend, that we see an upward trend of adults diagnosed with diabetes. So I think that that's a corollary of the association we're also seeing with an increase in the amount of obesity. If you look at the rise in the diagnosed cases here in Suffolk, it's been about a 33% increase since 2004. So it's definitely increasing. And there have been lots of conjectures as to why. One is this corollary I just mentioned with overweight and obesity. We know that that's associated. Now again, we're talking about type 2. I'm not talking about type 1. But for type 2, we know that that's very closely associated with obesity. Probably one of the more disturbing things in my mind is that this also, some studies would indicate, reflects that when we have medical care available, people know that they can get medicine. People sometimes don't take it as seriously. So they say, okay, so I have diabetes, I go to the doctor, I get my medicine. So they don't take it as seriously. But I think we need to take it seriously because look at the leading cause of blindness in the adult population is diabetes. 60% of amputations of the lower limb for non-trauma reasons is because of diabetes. It is the leading cause of kidney disease. Now, yes, we have medicines, yes, we have surgery, yes, we have things that can help you, but that certainly disables you. It makes you not able to play with your grandchildren as much as you'd like, to go to the park, walk with them, play with them. So it hinders your lifestyle. It makes it so perhaps you can't do the work that you've wanted to do for a number of years. So it's more than simply a factor of controlling it with medicine and healthcare. It also relates to your life, your lifestyle, your ability to enjoy your family, to enjoy your church, to enjoy things around you. So I think we have to get back and get hold of that concept. The good thing, if we can say a good thing about type 2 diabetes, is that it's one of the diseases that really lends itself very well to the impact of the behaviors of the individual. There are lots of diseases where that's not necessarily the case. Certainly type 1 diabetes, yes, your behaviors play a role, but
Sure.
Your behaviors were not the main contributor
Correct.
to it.
Right.
But for type 2 diabetes, we know that if you lose weight, if you exercise, if you eat right, many, many people can go off medicines and be perfectly fine.
And in some cases with that, you're talking about is subtle life changes in some instances, maybe a little more dramatic in others, depending upon your condition, but certainly you have the ability, as you said, to assist with that without going to the medicines or having to go to other means to do that you really control yourself.
This is a wonderful partnership between the individual and the healthcare provider. We have a tendency sometimes to, as I said, grow more reliant on the medicines because we know that we have them, but we're talking about enjoying life. And from a public health perspective, that's really, I'm not so much a clinician perspective, but I'm from a let's enjoy life perspective and have healthy living so you can enjoy the things that you want to participate in. So diabetes is one of those wonderful things where you can really have a major impact on that. I want to also add another perspective. We're a very hardy individual kind of country. We believe in individualism and we stand on that, and yes, I'm very individual as well. But I think that time has come, and it's long overdue, that we appreciate the economic impact as well as the lifestyle impact and work functioning impact of something like diabetes, because individuals do have such a strong impact on it. When you look at, it's estimated that a little over a fourth of people who have diabetes have kidney disease, a little less than a fourth have foot problems, and maybe a little less than 20% have eye problems. Well, now, let's translate that into dollars. Well, sometimes we don't like to talk about dollars on these things, but let's be real. Let's translate it into dollars. And if you look at the annual cost of, say, kidney disease, it's a little over $9,000 a year. You look at foot problems, it's about $4,500 plus a year, and you look at eye damage, it's about $1,800.
And those numbers are for the individual, correct?
Correct.
Right, exactly.
Now, let's translate that. Now, a lot of times we say we have insurance and it covers it. Okay, I understand that. We're still paying the premium.
Exactly, sure.
Okay, but we'll move beyond that.
All right.
Let's look at the uninsured population in Suffolk. A lot of people are uninsured or actually working, but they don't have insurance.
Exactly.
Or we have a lot of agricultural areas here, they're self-employed, they don't have insurance. But let's look at the uninsured population here in Suffolk. And it's estimated that here in Suffolk there are almost 1,700 adults who are uninsured who have type 2 diabetes. That's known.
Right. The diagnosed,
diagnosed.
Again, there's a high percentage of those who are not diagnosed.
Correct.
So it's a whole other.
So we're just going to look at the ones we know about.
Okay.
There are about 1,700 uninsured individuals. Well, now, those people still go to seek care when they're feeling bad. They still go to seek care when they are sick. Unfortunately, because of the lack of insurance, they may go to the emergency room. They may go to other places because they don't have a primary care provider.
Correct.
Hopefully a lot are going to the free clinic because, as I've said, I think that the corollary is that they definitely are making a difference.
Sure.
Now, if you look at the number of people based on those percentages who most likely have kidney disease or eye disease or foot problems, and the cost of each of those, I challenge you, or challenge the people watching the program, to give any estimate of what they think is costing in this one city of Suffolk to care for just this uninsured population.
Exactly.
It is costing over $6 million. That's the cost.
Right.
And that's not even taking into account the lost productivity, the absence of people to work and provide taxes back to the community.
Exactly.
So the absence of that input. That's just looking at 3 what we call microvascular diseases.
Correct.
The eye problems, the kidney problems, the foot problems, the amputations. That's just looking at those 3 diseases that are highly associated with type 2 diabetes. $6 million.
On an annual basis, yeah.
That's right.
Yeah.
We could do a lot with that.
Exactly. Understatement of the year right there, yeah.
That's right.
That's true.
We could do a lot
Right.
with that. But most importantly, in my mind, given the economic cost and the impact, but I think the really strong good side of diabetes is how it is so easily influenced by the individual's behaviors.
Exactly. And of course, with that being said, I mean that is, if you, go into a doctor, getting the checkups, checking your blood sugar levels and things, and knowing some of the early telltale signs that perhaps you need to look at that. But again, we're talking specifically about type 2, where you talk about the obesity rates and things with that, and how that is sort of leading you to the possibility of being diagnosed with diabetes, correct?
Right, right. There's a definite corollary. Some people call it diabesity,
right.
as a recent seminar did,
Sure.
and the speaker, because of that direct correlation with obesity and diabetes. And let's face it, we have lots of temptations in the community. We have maybe up to 50% of our restaurants are fast food places.
Right, right.
40 to 50%. Well, that's very tempting. I don't like to cook. I hate to cook.
Right.
So it's very tempting. But we also have grocery stores that have salad bars
Sure.
or things you can buy that are certainly much healthier.
Correct.
That you don't have to go to the fast food restaurants. So that's an important thing. That a big challenge for individuals is to recognize we cannot depend on willpower.
Correct.
You don't put chocolate cake in front of someone who's a diabetic and say, don't eat it.
Right.
They're going to eat it.
Exactly.
And I can't condemn them for eating it.
Right.
Same thing happens with me with cookies. Don't put cookies in front of me and tell me not to eat them. I'm going to eat them.
Exactly.
So the decision of how to help yourself, which is all we're talking about here.
Correct.
How to
Right.
help yourself, the decision occurs at the point of controlling your environment so it's more conducive to healthy living.
Exactly.
So you don't I don't buy cookies.
Take the temptation out of the equation,
Right.
if you will. Yeah.
If I buy cookies, it's because I'm buying one.
Right.
A place where I can buy one.
Exactly.
I don't buy a box of cookies.
Right.
Because they're going to disappear in a night.
Magic how that happens.
That's
yeah.
right. So the decision that people have total control over is to create an environment that's conducive to healthy living. To have, and when we talk about environment, we're primarily talking about your home environment.
Exactly. Exactly.
To have the things in your house then, to make that decision at the grocery store, it's a little bit easier to make it there.
Sure.
And to have in your house then the things that are more conducive to healthy living. And then ultimately you would choose them.
Exactly. Now, of course, one of the other things as far as when we start talking about obesity, and of course its direct relationship to diabetes, is the fact that we have younger people that, of course, that we're seeing more of an impact as far as type 2 on them, which historically had not been the case, but now is definitely trending that way as well, correct?
Oh, absolutely. And in my former life as a pediatrician, so I do have special concern about this. Let's put it bluntly. For the first time in the history of the United States, we are faced with the very real probability, not just hypothetical, the very real probability that our children will have a shorter life expectancy than us.
Right.
And that's even with all the medical advances that we have.
Right.
That's very disturbing.
It is.
That's not a legacy I want to give to my children.
Right.
And yet that is where we are because of the increase in obesity and diabetes and other diseases,
Sure.
but primarily those in children. We used to have a very clear delineation. There was juvenile diabetes,
Correct.
and there was adult diabetes.
Right.
Type 1 for children, type 2 for the adult.
Not
There's
anymore.
not that distinction anymore.
Right. Right.
And it's very, very scary and very disturbing. And even more significant is those kids are not the ones doing the grocery shopping
Exactly.
for their
Yeah.
household.
Yeah.
It's their family members, their parents or aunts, uncles, whomever, who are doing the grocery shopping. So we have much greater control over that.
Correct. And again, you don't think about that when you're in the grocery store, but of course you get home, you say that temptation is there, that situation is there. And it's not just about food, it's also about the exercise and the other components of
sitting
creating
there
a
doing this all day, right?
You work the fingers, but that's
I
about
have
it.
two teenagers,
Exactly.
I know, they're doing this.
But it's creating that healthy environment that you talked about that will actually help you kind of make the better choices and if you will, take, as you said, take willpower out of it, because again,
Right.
you've got the environment there to help you as well.
Right.
So,
Right.
okay.
So you want to, even simple things, you go to the grocery store, you don't park close to the grocery store. You park far away from
Exactly.
it. You go shop, park far away from it. So again, you got to walk there. You
Right.
want to go to the grocery store, so just you can control where you park your car.
Or taking the steps instead of taking the elevator if the opportunity
Absolutely.
presents itself. So,
Absolutely. If you have a dog, walk the dog. I walk the dog twice a day. It's a
There you
huge
go.
help.
Yeah. Well, Dr. Welch, I want to thank you for your time today to talk about, again, what's going on with diabetes as far as in the city of Suffolk, with some of the trending as far as with the numbers, as well as, again, just kind of talking a little bit about type 2 and the impact it has both from a societal as well as a financial perspective, aspect as far as on the city of Suffolk.
My pleasure to be here. Thanks for asking questions.
Okay. And again, we want to remind you this is Healthy Living, and want to leave you with To Your Health.